So our third speaker this morning is Dr. Win Htat, and he comes to us from PSI in Myanmar. He's going to speak to us a little bit about the lessons we can learn from global corporations like McDonald's in marketing our products of social change. When I asked Dr. Htat about his favorite sport, what do you think he said? Ice hockey, amazing. He's an ice hockey fan. Not only is he an ice hockey fan, he is a fan of the Toronto Maple Leafs, who just made the playoffs. And so we hope they will not be underdogs going forward. So thank you, welcome.
Thank you. So good morning. So good morning, ladies and gentlemen. I'm Win Htat. I came from PSI Myanmar, as known as Burma. And thank you, Mr. Chair and Stephen Thomas, for their sponsoring this session. Before I start my presentation, I'd like to request all of you to stand up. And yesterday, we had that every word we say change, there will be $1 each contribution to PSI community. And I saw yesterday only $358. So I think we are the best marketer of the world. We can make more, So that please join me. Raise. I will say 1, 2, 3, and then we will say change. Really? Okay. And then 1, 2, 3. Change. Great. Thank you very much. Sit down, please. So then now we raise 500 multiplied by 3, so 1,500. And thank you very much, Manifest, for your kind generosity. Yes. And the presentation I'm going to make today is from Big Mac matches to IUD insertion. So I'd like to start my presentation with a question. Is franchising a solution to scale sustainable health impact in emerging markets? So it's kind of like comparison between the commercial franchise and the social franchise in public health. So I did research because I live in Myanmar the whole my life, and so made the short trip to the Western world. So that's before I came here that I did research how is the similarity between that social marketing and commercial marketing from Asia to North America. So this is how I did my research. So I taste McDonald's in Bangkok, San Francisco, and Toronto. This is the picture I took in Toronto. You will see the Canadian the flag there. So then I will present later on how they are similar. So what is franchising? This is my definition: is taking a proven business model to scale efficiently to minimize business risk. And we all know that McDonald's is a global franchise in the fast food industry. So they have more than 34,000 outlets worldwide and in 190 countries with 1.8 million employees serving 68 million customers every day. That's amazing. So we looked through their business model. We found several key components in their business model. So those key components are their foundational principles, their mission, value, how they maintain their brand, how they set their standards, their franchise operating system, and their financing mechanism. So I will go through a little bit of detail of those key principles. So I start with the foundational principles. When the record, the founder of McDonald's Corporation, when he started his business in 1955, so he focused on the 4 foundational principles: quality, service, cleanliness, and value. And one time he said that if I had a break for every time I have repeated the phrase of quality, service, cleanliness, and value, I think I'll probably be able to bridge the Atlantic Ocean with them. So that's how they make their focus on those 4 foundational principles. And this is their mission. You will see that there is nothing about how good their food to be. It's all about their customer experience and changing the influence in their lifestyle. And their value. They have several values, and they are trying to continue to integrate values in their business system. So the brand. So those previous three, the foundational principle, mission, and values, I would say they are the roof of their business model, and supported by the following four key components. The one is the brand. As we know, that McDonald's is the one unifying brand, and all the customers, the shareholders, and the supplier, we know what to expect from McDonald's. So they maintain their brand. And they have pretty high standards. That's the reason why my burger in Bangkok and San Francisco are the same taste as my burger in Toronto. So they have the high standard, they follow their standards, and all the restaurants perform their standards in three key areas: quality, service, and cleanliness. And they have the area supervisor in each restaurant. They do complete audit in every 6 months, and also their weekly checking of their standards and the client experience. So these standards are used to maintain their brand. And the franchise, that's what really defines their franchise. In business for yourself, but not by yourself. And their franchise system was supported by the world-class training, world-class service, and support system. In 1961, they developed a training program. Now they later called Hamburger University. In Hamburger University, all their franchisees, their operators were trained for 9 to 18 months. And then now more than 80,000 people, they are graduated from the Hamburger University. And the financing, they are quite complicated financing mechanism. I won't go detail about their financing mechanism, but it is not easy to own a McDonald's shop actually. In US, for the initial cost, that will cost around about $750,000 US to set up, and followed by the monthly costs. So in 2012, they earned $27.6 billion with net income of $5.5 billion. So that's amazing. And then we look at what is the success behind. As the previous 7 the key components, they have their good business model that made them the global giant in their business. So then the question came, is franchising, here the Sous Chef franchising, is a solution to scale sustainable health impact in our emerging world? I think the answer is yes. Why? This is our clinic in Myanmar. This we call Sun Quality Health Clinic. Sun Quality Health Clinic is a network of professional general practitioners, so who are providing the quality and affordable health services for the community they serve. So this is the area that we are operating, and we are operating almost to that of the country. Now we have 1,500 Sun Quality Health Clinics. We are providing, these are the major public health problems in Myanmar. Reproductive health, pneumonia, malaria, diarrhea, tuberculosis, and HIV-related services they are providing. Yeah, as like McDonald's, we also have their foundational principles. We focus on quality. So the quality of services we provide. We focus on equity. We want to serve more poor and vulnerable people. We focus on access. We want to maximize our scale, that is to increase the number of outlets, at the same time to maximize the scope. That is more integration of services in our operation system. And then value. So we want to provide good value to our donor, that is their cost efficiency, and then we want to provide good value to our client, that is they are affordable to the quality services we provide. So our mission, as like McDonald's, our mission is focusing on our clients we serve, as to empower them to healthier lives. So, and also we have vision that every person should have quality and affordable health services where and when they need them. So these are the values like McDonald's. So we are very result oriented, and we are accountable to the clients, our customer, our partners, and our donors. And when we find problem, we own the problem, and we act professionally to solve the problem. We will find innovative way to improve the health impact. And we believe that we can achieve our goal only by giving dignity of choice to our clients. And we want to improve our service to both internal and external customers. So the brand. The Sun Quality Health brand, it was a little bit tricky to promote their brand. So we were not allowed to promote their brand. Just very recently, last year, we were allowed to promote their brand. And then we started producing the TV commercial to promote their brand. I will show some TV commercial. So that TV commercial is promotion of the reproductive health service. But although we are providing reproductive health service in our TV commercial, but actually USC TV commercial, we are selling dreams to the women.
Badu maso ko mitasu atwe pomo kaung mon ne bawa imet twe shi ja ma ba.
တင်ဘဝအိမ်မက်ကိုကောင်းထည့်ဖော်ပါနေစည်းကမှလည်းတားဆက်ချနိုင်ပါတယ်
Badu maso ko mitasu atwe pomo kaung mon ne bawa imet de shi ja ma ba.
တင်ဘဝအိမ်မက်ကိုကောင်းထည့်ဖော်ပါနေစည်းကမှလည်းတားဆက်ချနိုင်ပါတယ်
Badu maso ko mitasu atwe pomo kaung mon ne bawa imet twe shi ja ma ba.
တင်ဘဝအိမ်မက်ကိုကောင်းထည့်ဖော်ပါနေစည်းကမှလည်းတားဆက်ချနိုင်ပါတယ်
So we developed those TV commercials last year. Now those TV commercials are on air. So previously, although the women are receiving best patient services, they didn't aware of the quality clinic, and so now we are start promoting this brand. So that like McDonald's, we also have standards. So our standards are not only medical standards. So we did the market research, and many clients said non-medical standards are also important to them. They want to improve their marketing standard, like what is the branding, what kind of IEC materials they can get from the clinic, that their customer experience, like what is their waiting time to receive that service, and then their productivity standards. We put it into our service delivery standards for the Sun Quality Health clinics. Like McDonald's, we also provide the training and the service monitoring and supportive supervision to the Sun Quality Health clinic. So the current operating system, this is the typical Sun Quality Health doctor. So most of them are around about 50, 55 years. They finished their medical school maybe 20 years ago. After that, they never received very little, they received international health training, and that they are hang out to serve their community. We are trying to provide the needed services to them. So we are focusing on the selecting and the maintaining of the provider in the network, improving the both quantity and quality of service we provide, and then the standard management, and the providing the training and the recognition and giving reward to the high performers in the network. Our financing mechanism, we have both client-side financing, like to reduce the financial barrier to the clients, like providing vouchers, conditional cash transfer, and also their travel reimbursement. And also the provider incentive, like the skill incentive and performance-based incentives. And we also provide free drugs with the support from the national TV program. But TV is quite a long treatment, about 6 months, so that we provide free drugs to those clinics. So this is our contribution to national health system. In 2012, we treated 14% of all national TB treatment, and 100,000 pneumonia treatment for children under 5. We are contributing 1.5 million family planning consultations. That represents 50% of national needs. 60,000 malaria treatment, 56,000 STI treatment, sexually transmitted disease, 11,000 HIV testing and counseling in Sun Clinic, and 270,000 diarrhea treatment. That's how Sun Quality Health Doubters are contributing to the national public health burden. There are also challenges. The challenge is aligning the provider and client's need because the Sun Doubters, they are general practitioners, most of their clinics are outpatient clinic. But many clients, they want the emergency care and obstetric and gynecological care. That kind of service we cannot provide. And securing the funding, because the network grew very rapidly. Now we have 1,500, and now it's a big network, and then it's difficult to maintain the quality products and monitoring support to that big network. And also that local difficulties like we have to deal with, because we work in 2/3 of the country, so that different local administrative and health authorities for different programs. So how different is Sun from the McDonald's? Basically, they are the same in the concept and model, but the difference is that our franchise model is fractional franchise. That Sun Doubters, they have done their business for less 20 years, and we just added a few services, standardized services, so that they can also provide other services. Otherwise, the McDonald's is a full franchise. It's all the restaurant the same service. And McDonald's may measure their success in the dollar profits, and we measure our success in the health impact. Our currency is health impact. So this is my presentation is about the PSI Myanmar. This is the global snapshot of what the social franchising programs globally. Social franchising is quite new public health methodology. It's about 25 years, but rapidly growing. In 2010, there were around about 40 social franchise networks. And 2011, it grew up to 50. In 2012, now we have 75 programs operating in 40 countries, providing that 32 million clients by 45,000. And not only PSI, other partners like MSI, WHP, Kimonis are also providing their public health services at the front line. I think we should also give clap to them. So PSI is operating in 1/3 of that all Sous Chef franchise program. We are working 27 programs in 26 countries. I think that is my presentation, and if you want to know more, that I will leave the website, and then you can see and more. And there is another session at 11 o'clock. My colleague, Professor Dominic Montague from University of California, San Francisco, will give the PSI Myanmar Sous Chef franchise program, and also Amnesty from the Johns Hopkins will give more about effectiveness in the PSI Sous Chef franchise program. As Rico said, none of us is as close as over us. So I think the people in this room, I think this is the people that I believe that we can change the game, we can change the world. So thank you very much.
Wonderful, wonderful.
Thank you.
So, stay here.
Yes,
We'll see if there's some questions. Any questions for Dr. Tat? Yes. Microphone there. Oh, she's running. She's running. There she is.
Thank you, that was lovely, and it's good to see the work that's being done in these countries. So you said you had about 1,500 franchises around Myanmar?
Yes.
And so that's presumably in rural areas as well?
Yes.
So what is the reach of TV commercials, or what is the availability of TVs to the rural populations in Myanmar?
Yes. Actually, our Sun Quality Health Doubters, they are mainly working in urban and peri-urban areas. And for the TV commercial, we decide our placement strategy is based on the disease. Examples like malaria, pneumonia, and diarrhea are in the rural diseases in the country. So that at that time, we won't use TV commercial for those disease. But like tuberculosis and family planning, we use TV commercial. TV coverage is about 45% of the country, mainly in urban and metro area.
Good, and you have other
Yes.
ways of reaching.
Yes. Yeah.
Thank you.
Thank you.
Someone else? A question? Okay, thank you. I'm sure Dr. Tat would.
The one day.
I'm
one
sorry.
day. Please.
There you go.
Hi,
please.
I just wanted to say this is a very fun and provocative idea. So I just wanted to ask when you'll be incorporating the drive-up window at Sun Quality Health. Just throwing it out there.
Yeah. Yeah.
I can't fail to mention that McDonald's isn't the same all the way around the world because I don't know anywhere else in the world where you can get a McLobster sandwich. And that's what you can get in the east coast of Canada.
Yeah.
A lobster sandwich as opposed to a hamburger. So
Yeah.
thanks again.
Thank you very much.
Yeah.
Mr.